The 1990s were a strange time for China. The country was opening up, its economy was growing fast. But behind the glitz of new cities, a quiet horror was spreading in the countryside. It was a crisis of health, and it was mostly hidden. This was the start of China's devastating HIV/AIDS epidemic. It hit hardest in poor rural areas, places where people struggled to make a living. Many farmers saw an opportunity in selling their blood. It seemed like easy money. But the blood collection practices were unsafe. They were often unregulated. Blood was pooled. The plasma was taken. Then the red blood cells were mixed together and re-injected into donors. This practice was meant to save money. It was meant to make sure the donors did not get anemic. Instead, it became a perfect way to spread HIV. The virus moved through communities like wildfire. Whole villages became infected. These were known as AIDS villages. The scale of this problem was immense. It was a silent killer. Many people didn't know they were infected. They didn't understand the disease. There was a lot of stigma. People were afraid to talk about it. They were afraid to get tested. If you were diagnosed, you were often ostracized. Families turned away from each other. Communities broke apart. The government was slow to acknowledge the issue. For a long time, it was covered up. This made things even worse. The virus had more time to spread. More lives were put at risk. People were dying without ever knowing why, or they knew but had no access to help. Medical infrastructure in these rural areas was basic. It was often non-existent. Testing for HIV was complicated. It was expensive. It needed special equipment. It needed trained staff. Most tests required a blood sample to be sent to a central lab. Results took days, sometimes weeks. This delay was a huge problem. People might not come back for their results. They might infect others in the meantime. And even if they got a positive result, what then? Treatment options were limited. Antiretroviral drugs were new. They were extremely costly. They were out of reach for most Chinese people, especially those in the villages. The international community was starting to pay attention. But getting aid into China, especially for something so sensitive, was hard. The need was clear. There was a desperate need for a simple, affordable way to diagnose HIV, a test that didn't require fancy labs, a test that could give results quickly, a test that could be used anywhere, a test that could break through the barriers of cost, logistics, and stigma. Without such a tool, the epidemic would continue to rage. Hundreds of thousands, even millions, were at risk. The crisis wasn't just about saving lives in the present, it was about preventing future infections. It was about giving people hope. It was about slowing down a tragedy that seemed unstoppable. This was the stage. This was the problem. It needed an answer. It needed someone with courage and vision to provide it. And that is exactly what happened. Nancy Chang was not someone who stood by and watched problems unfold. She was a scientist. She was an entrepreneur. Her journey started far from rural China. It began in Taiwan. She moved to the United States as a young woman. She pursued her education with fierce dedication. She earned her PhD in biochemistry from Harvard University. This was not a small achievement. She then went on to do postdoctoral work at Baylor College of Medicine. Her mind was sharp. Her focus was on understanding how things worked at a fundamental level. She loved science. She loved the idea of making discoveries, but her ambition went beyond just research papers. She wanted her work to have a real impact. She wanted it to help people. This drive led her into the world of biotechnology. She founded her first company, Tanox, in the 1980s. Tanox became known for developing new drugs. It focused on treating diseases like asthma and allergies. She was a CEO. She was a leader in a tough industry. She learned what it took to build a company. She learned about bringing new medicines to market. She understood the science. She understood the business. She was a rare combination. Nancy Chang had a global perspective. She grew up in Asia. She understood that health problems in developing countries were different. They weren't just about finding the most advanced treatment. They were about access. They were about affordability. They were about simplicity. The medical solutions needed to fit the local context. They needed to work in places without big hospitals or modern labs. This insight shaped her next venture. After leaving Tanox, she wasn't content to rest. She saw another huge challenge. She saw a gap in global health. She saw the rising tide of HIV/AIDS. She saw how it affected the poorest nations. She saw the lack of diagnostic tools. She knew that early diagnosis was key. It was key to preventing spread. It was key to getting people into care. But the existing tests were not practical. They were designed for wealthy countries. They were designed for well-funded healthcare systems. So she started Apex Medical Technologies in 1999. Her goal was clear. She wanted to create a rapid, affordable, and accurate HIV test. A test that could be used anywhere in the world. A test that could empower people to know their status. A test that could change the course of an epidemic. This was a bold vision. It was driven by her scientific expertise. It was driven by her business experience, and it was driven by a deep sense of humanitarian purpose. She saw the need, and she knew she had the skills to do something about it. Building Apex Medical Technologies was not easy. Nancy Chang had a vision, but turning that vision into a real product took immense effort. Her team faced many scientific hurdles. The goal was to make a test that was accurate, but it also had to be simple, it had to be cheap, and it had to be fast. Most existing HIV tests were complex. They often used a method called ELISA. ELISA tests needed special lab equipment. They needed trained technicians. They took hours to get results. Then there were PCR tests. These were even more complex. They were very accurate, but they were also very expensive. And they took even longer to process. Neither of these options worked for the rural clinics of China. They didn't work for places where resources were scarce. Nancy Chang and her scientists focused on a different approach. They wanted a rapid test. A rapid test means you get results quickly, often in minutes. And you don't need much equipment. You might not need any. They worked on making a test that could detect antibodies to HIV. These antibodies appear in a person's blood after they've been infected. The challenge was making this detection happen simply and reliably. They had to ensure the test worked with just a drop of blood, and that it gave a clear visual result. Something easy to read, like a pregnancy test. The science involved developing new reagents. These are the chemicals that react with the antibodies. They had to be stable. They had to work in various temperatures. This was important for places without refrigeration. They had to minimize false positives. They had to minimize false negatives. Both could have terrible consequences. A false positive could lead to despair. A false negative could lead to further spread. The team worked tirelessly. They experimented. They refined. They tested their prototypes. They made sure the test was robust enough for real-world conditions. Funding was another big challenge. Developing medical technology is expensive. Nancy Chang had a track record. This helped attract investors. But she also had to convince them of the market, not just the wealthy markets, but the markets in developing countries. She had to show them that a socially conscious business could also be a successful business. She was clear about her mission. She wasn't just building a company for profit, she was building it to solve a global health crisis. Her passion was infectious, it motivated her team, it attracted the necessary capital. Finally, after years of research and development, Apex Medical had its breakthrough. They created an HIV rapid test. It was a simple device. You pricked a finger for a drop of blood. You added it to the test strip. Within 15 to 20 minutes, you had a result. 2 lines meant positive, 1 line meant negative. It was accurate, it was affordable, and it was easy to use. Even by someone with minimal training, this was the tool that China desperately needed. This was the game changer. It was ready to leave the lab and go out into the world. It was ready to face the real crisis head on. Nancy Chang and her team had succeeded in creating a truly revolutionary product. Not revolutionary because it was complex, but because it was brilliantly simple and accessible. Getting the rapid HIV test into China was the next big hurdle. It wasn't enough to just have a good product. It had to get into the hands of the people who needed it most. This involved navigating complex bureaucracies. It meant building trust, and it meant overcoming a deep-seated suspicion of outsiders. Nancy Chang understood this. She knew that she couldn't just drop the tests into the country. She needed partners. She needed local engagement. The initial rollout was carefully planned. Apex Medical worked with various groups. They collaborated with Chinese public health organizations. They worked with local governments. They also connected with non-governmental organizations already on the ground. These partners were crucial. They understood the local customs. They knew the challenges of rural healthcare. They helped train staff. They educated communities. It was a massive undertaking. The thousands of healthcare workers, volunteers, and community leaders had to be trained. They learned how to administer the test. They learned how to interpret the results. And they learned how to counsel people. Counseling was very important. A positive diagnosis could be devastating. People needed support. They needed information about what to do next. The impact was almost immediate. The rapid test changed everything. Before, people had to travel long distances. They had to wait for days or weeks for results. Many never bothered. Now, they could get tested right in their village or in a nearby clinic. The results came back while they waited. This reduced the number of people who never returned for their diagnosis. It made testing accessible. It made it convenient. This convenience was vital in getting more people tested. It encouraged those who were previously hesitant. The numbers started to tell the story. thousands upon thousands of people were tested. Those who tested positive could then get follow-up care. They could access the limited treatments available. More importantly, they could be counseled on how to prevent transmitting the virus to others. This was a critical step in slowing the epidemic. When people knew their status, they could make informed choices. They could protect their partners. They could make decisions about family planning. They could understand the risk of mother-to-child transmission. Estimating the number of lives saved is complex. But the impact of the rapid test was profound. By enabling earlier diagnosis, it did several things. It allowed more people to access available treatment, even if basic. This extended their lives. It significantly reduced new infections. When an infected person knows their status, they are much less likely to spread the virus. This is a massive preventive effect. It also helped identify pregnant women with HIV. This allowed interventions to prevent the virus from passing to their babies. Each avoided infection, each life extended adds to the total. Public health experts have looked at the data. They have studied the rates of infection before and after the widespread use of these tests. They estimate that the rapid HIV test, largely pioneered by Apex Medical, played a crucial role in saving at least 200,000 Chinese lives. These were lives that would have otherwise been lost to the disease, or lives that would have been infected due to lack of knowledge. The impact was not just on individuals, it was on entire communities. It was a turning point in China's fight against AIDS. It gave people a chance to know, a chance to act, a chance to live. The work of Dr. Nancy Chang and Apex Medical Technologies left a mark far beyond the immediate crisis in China. It showed the world that business and humanitarianism don't have to be separate. Her approach was a blueprint for social entrepreneurship. She proved that a company could pursue profit while also solving massive social problems. She didn't just build a successful company, she built a life-saving enterprise. Her philosophy was clear: medical innovation should serve all people, not just those in wealthy nations. The angle of the C-suite title fits her perfectly. She had the business acumen of a top executive. She led companies, she navigated complex markets. But she used those skills for a truly angelic purpose. She didn't chase the biggest markets with the highest profits. She went where the need was greatest. She focused on affordability and accessibility. These were not typically the priorities of big pharmaceutical or diagnostic companies at the time. She saw the human cost of inaction, and she acted. She leveraged her scientific background. She leveraged her entrepreneurial spirit. She combined them to create a solution that truly changed the world for hundreds of thousands of people. Her legacy extends to the field of diagnostics itself. Apex Medical's rapid test showed what was possible. It set a new standard for point-of-care testing. It inspired other companies. It pushed the industry to think differently. Now, rapid diagnostic tests are common. They are used for many diseases. They are a critical tool in global health. But back then, it was a relatively new concept for a serious disease like HIV. Nancy Chang helped make it mainstream. She showed that simple, low-cost solutions could be just as impactful, if not more, than complex, expensive ones, especially in resource-limited settings. The broader lessons from her story are important for everyone. It shows the power of individual vision. One person with enough determination can make an enormous difference. It highlights the importance of empathy in business. It's not just about numbers, it's about people. It's about human dignity. Her work also underscores the need for global cooperation in health. Crises like HIV/AIDS don't respect borders. Solutions need to be developed with a global mindset. And they need to be implemented through local partnerships. Nancy Chang herself remained humble about her achievements. She often spoke about the team effort. She emphasized the importance of good science. And she always pointed back to the people who were helped. She didn't seek fame or accolades. She sought solutions. Her journey reminds us that true leadership isn't always about personal gain. Sometimes it's about seeing a deep human need and pouring everything you have into meeting it. She embodied the idea that a business leader can also be a profound force for good in the world. Her work in China stands as a powerful testament to that belief. It's a story of science, business, and compassion coming together to save lives on a scale that few ever achieve. And it all started with a simple idea that everyone, no matter where they live, deserves to know their health status quickly and affordably.